Good afternoon, everyone. So this is Dr. Pratik More. I am a assistant professor at YMT College, Kharghar, in the subject of anatomy. Okay. So today we are going to learn something about pancreas. A very important, very essential organ in your practice also, for your exam also, obviously, but for your practice also. It is especially important because it is related with so many diseases in your day-to-day life. You will get to notice there are several patients which have the disorders related to the pancreas. So the learning of the pancreas is extremely important. uh, yeah, somebody raised their hands. Okay. I guess you all are able to hear me. I hope you are. Okay. So let's begin with the presentation of the pancreas so that you can learn. So the pancreas, that pancreas is the name itself suggests pan and krias. Okay, there are two words, pan and krias. Pan is all and krias is flesh. Like currently you uh, must have heard the word pandemic, the COVID pandemic. Pandemic, why it became pandemic? Pan is, it has covered the entire world. It is all the world, all across the globe it is there. That's why it is called as pandemic. Likewise, the pancreas is pan, that is entire, that is all. Krias, that is flesh. So pancreas is a very fleshy organ. If you hold it in the hand, you will find it very soft and velvety kind of a organ. Okay. So it is partly exocrine and partly endocrine. These two words are like exo and endo. Exo is outside and exo is inside. Okay. So partly exocrine, that is, it produces some pancreatic juices, and endocrine, it releases some hormones. Okay. Exocrine part secretes the pancreatic juices, and endocrine part secretes the hormone like insulin, glucosylceramide, likewise. Okay. So the pancreatic juice, obviously, it is going to help in the digestive part. Okay. Digestion, it will help in the digestion of carbohydrates, lipids and proteins. Okay. And the endocrine part, okay, that is the insulin, especially the insulin. Everybody must have heard about the insulin, what essential role it has in the diabetes mellitus, in the control of your blood glucose sugar level. Okay. Then blood glucose levels. Then uh, so the endocrine hormones, they're actually endocrine are ductless. They mix in the blood directly. Okay. So the pancreas is a soft, lobulated, and elongated. It is very soft, it is elongated, and it is lobulated. Okay. Then we should see the location. Anatomically, it is extremely important to understand the location. You must have learn the 9 quadrants or the 4 quadrants. Okay. 4 quadrants are the right, left, right lower, left lower, right upper, right lower, left upper, left lower. Likewise, there are 9 quadrants also, right hypochondriac, epigastric. You must have done all these things. Okay. So location, it is situated on the posterior abdominal wall. Okay. So it is not present in front. It is situated, ये front में जितने organs दिखाई देंगे, फ्रंट में जितने सारे ऑर्गन्स दिखते हैं उसमें नहीं दिखाई देगा. इट इज प्रेजेंट ऑन द पोस्टीरियर एब्डोमिनल वॉल, बिकॉज फ्रॉम फ्रंट इट इज द ऑर्गन्स व्हिच आर प्रेजेंट इन द एंटीरियर एब्डोमिनल वॉल, उसमें जो दिखते हैं वही दिखेंगे. ओके. पोस्टीरियर एब्डोमिनल वॉल, देन एपिगैस्ट्रिक and left hypochondriac region, that is the epigastric and the left hypochondriac region. So it begins something around here and then it goes like here. Okay. So it is present in the epigastric and left hypochondria. That extent is T12 vertebra to L3 vertebra. The organs which are generally present in the posterior abdominal wall, okay, they are indicated by this extent as well. Okay, that is the extent of the vertebra. So in front of which vertebra or till the extent of these vertebra, that is thoracic 12, L1, L2 and L3. Okay. Then it is retroperitoneal. Retroperitoneal is, retro is behind. Okay, it is retroperitoneal, that is the behind the peritoneum. Okay, okay, you're clear until this? Okay. Then size and shape. It is J-shaped or retort shaped. It is a J-shaped or retort shaped, but the J is generally we draw J like this. Yes, simple. But it is not like that exactly. It is like this. Yeah. So that's why it is called as retort shaped also, and obliquely placed. Obliquely, it is not horizontally placed. It is not vertically placed, but it is placed obliquely. Okay. Length is around 12 to 15 centimeters. The width is around 3 to 4 centimeters. Thickness, it is around 1.5 to 2 centimeter, about an inch thick. And the weight is around 80 to 90 gram. The weight is not so great because it is a fleshy organ. Understood? It is a soft fleshy organ. So the weight is 80 to 90 grams. Okay. Then coming to the anatomy of pancreas, the parts especially. Okay, so there are how many parts? There are 4 parts, right? Simple it is. Like your head, neck, body, and tail. Likewise, in pancreas, you will get the head, then the neck, then the body, and then the tail. Okay, so the parts are present like this: head, neck, body, and the tail. Okay, head, neck, body, and the tail. Okay, got it? Here we have demarcated the parts exactly. Okay? Head, neck, body, and the tail. In this diagram, you can see this one is the head, a small part that is the neck, then this major horizontal part is a body, and the last wala part is the tail. Okay? Okay. Head of the pancreas. Okay. So the head of the pancreas is enlarged and disc shaped. Okay. Uh, the J, the lower limb of the J, okay, it is, that is the head, and head is enlarged compared to the whole body. You can see the head is enlarged and it is disc shaped. The compact disc, right? It is disc shaped, a circular, likewise a thoda circular shape, lies in the C-shaped concavity of the duodenum in front of the L2 vertebra. Okay, so let's go one by one in this sentence. Lies in C-shaped concavity. That is, C-shaped concavity is of duodenum. We all know the duodenum is a first part of the small intestine. It is the most fixed part of the small intestine, and its shape is C-shaped. There's the first, second, third, and fourth part. Can we go back a little? Okay, can we go back a little? Yes. So this is a duodenum. Okay. So duodenum begins here somewhere. This is the first part. Then this vertical is second part. Then this is a third part, and then thereafter there's a fourth part. So this C-shaped concavity accommodates the head of the pancreas. Got it? This C-shaped concavity of the duodenum accommodates head of the pancreas. Okay. So the first point is clear. Lies in the C-shaped concavity of duodenum. Then next point is in front of the L2 vertebra. So we already know that the pancreas is situated in front of the T12, L1, L2, and L3 vertebra. The extent is in front of these vertebrae. Okay. So amongst these 4 vertebrae, the head of the pancreas is situated in front of the, at the extent of L2 vertebra. Okay. Then head of the pancreas has 3 borders. One border is superior border, second is inferior, and third is the right lateral border. Okay. So this right lateral border can be called as right border, or lateral border, or you can call it as a right lateral. Okay, then it has two surfaces, anterior surface and posterior surface, and one process, uncinate. Okay. So it is simple. See, you can remember this: 3, 2, 1. 3 borders, 2 surfaces, 1 process. So 3 borders are superior, inferior, and right lateral. See, in the head there are superior, inferior, and right lateral. Superior border, inferior border, and right lateral. Superior, inferior, and right lateral. Simple it is, very simple. The head has 3 borders. See, we will not consider this as a 4th border because this is a continuation part of the pancreas. So, superior border, inferior border, and right lateral border. Okay. Why it is called as right lateral and not the left lateral? Because 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 your this border is to the right of the median plane. Is to the right of the median plane. Okay, median plane is a plane which cuts your body into two halves, right? Two equal halves. Okay, so it is to the right of the median plane. That's why the border is called as right lateral border. Okay, then two surfaces. One is anterior surface and one is posterior surface. One is anterior surface and another is posterior surface. And one process, that is the uncinate process. See, this process is the uncinate process. This extension, head ka, this is an extension. That extension is called as process. Okay, so it is called as uncinate process. Simple, head में 3 borders, 2 surfaces, and 1 process. 3 borders, superior, inferior, and right lateral. 2 surfaces, anterior and posterior, and 1 process, that is uncinate. Now you have to understand, because anatomy is very essential to understand the relation between the organs. So you have to understand borders का relation, superior border के relation में क्या आएगा, inferior में क्या आएगा, right में क्या आएगा, surfaces के relation में क्या आएगा. This is simple thing, okay. So if you are smart enough, see, if it is accommodated by the C-shaped concavity of the duodenum, you will understand superiorly क्या होगा, right में क्या होगा, inferiorly क्या होगा. It is very easy to understand. ठीक है, यहाँ पर हम लोगों ने already ये bile duct देखा है ना, which is in a this dot 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 dot. So dot 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 means posterior side. So it is going to be really easy. Okay, we'll go ahead. Relations of the head. First is superior border. And first we learn the superior border. Superior border, simple. First part of the duodenum. It is related to the first part of the duodenum. Obviously, because we learn that it is accommodated, it is present in the concavity of the C-shaped concavity of the duodenum. तो ऊपर क्या होगा, फर्स्ट पार्ट, सबसे नीचे क्या होगा, थर्ड पार्ट. ओके, तो सुपीरियर में फर्स्ट पार्ट ऑफ द duodenum, inferior में third part of the duodenum. Simple. Okay, then it is related to the superior pancreatico-duodenal artery. Which artery? Superior pancreatico-duodenal artery. Superior obviously, because it will supply the superior part of the pancreas and duodenum. So it supplies both the pancreas and duodenum. Okay, superior pancreatico-duodenal artery. Inferior border, it is the third part of the duodenum, and it's related to the inferior pancreatico-duodenal artery. Okay, then right lateral border. Third border is the right lateral border. It is related to the second part of the duodenum and anterior and posterior pancreatico-duodenal arterial arcades. Okay, तो यहाँ पर क्या है, राइट में सेकंड पार्ट आएगा ऑब्वियसली, ऊपर फर्स्ट, नीचे थर्ड और साइड में सेकंड और सेकंड पार्ट को जो ब्लड सप्लाई होता है, इट इज with the help of both these superior pancreatico-duodenal एंड इंफीरियर पैनक्रियाज, है ना। इसकी जो ब्रांचेस है ये दोनों सप्लाई करते हैं, और इसकी जो दोनों ब्रांचेस है वो है एंटीरियर ब्रांच एंड पोस्टीरियर ब्रांच। मतलब उस ये जो पार्ट है, राइट लैटरल वाला पार्ट जो है, वो सप्लाई होता है आगे से भी और पीछे से भी, दोनों साइड से उसको सप्लाई किया जाता है। ठीक है, सो इट फॉर्म्स आर्टेरियल आर्केड, arterial arcade. Okay, then the anterior surface. So what is present anteriorly? Anteriorly, gastroduodenal artery, transverse colon, and jejunum. Okay, and the posterior surface, it presents IVC, that is the inferior vena cava, left renal vein, common bile duct, and right crus of the diaphragm. Okay, so IVC, that is inferior vena cava, you can see inferior vena cava on the posterior aspect. See, your IVC and your abdominal aorta will always be present on the extreme posterior. Will always be present on the extreme posterior. That's why you will see IVC and abdominal aorta in the relation of the fellow organ, duodenum also. Okay, or else portal vein. Everything in all these organs, IVC will be related posteriorly. Okay, it's quite easy to remember. IVC will be present posteriorly. Then left renal vein. Left renal vein is a major tributary of inferior vena. Okay, that is also can be seen. Then CBD, that is a common bile duct. Common bile duct enters the second part of the duodenum. Its destination, its ultimate destination, is to reach the second part of the duodenum along with the pancreatic duct, main pancreatic duct. Okay, so it is present. It comes from behind the head of the pancreas and enters into the second part of the duodenum. That's why the common bile duct is also present on the posterior surface. Then right crus of diaphragm. Okay, next, so you can see relations of the head. This is the head, this is the main pancreatic duct, which is carrying all the pancreatic juices from everywhere, and then it's coming here, and it is entering here along with the common bile duct. Okay, so pancreatic juice and bile juice both are entering in the second part of the duodenum, where there is major duodenal papilla. यहाँ पर enter करते हैं and it helps in the digestion. It is the most essential process of the digestion. So this common bile duct enters from behind the pancreas. Okay, understood? So here is the first part of the duodenum, which is related to superior border. Second part related to the right border. Third part, it is related to the inferior border. Simple it is. Okay. Head में there is a process that is called as uncinate process. So uncinate process is a small process, and you can see the relations. And anteriorly, it is related with the superior mesenteric vessels. Superior mesenteric vessels anteriorly, and posteriorly abdominal aorta. Just now I told you that abdominal aorta and IVC both will be seen in the posterior relation of numerous organs, because these are the structures which are present to the extreme posterior aspect. Okay, so anteriorly, superior mesenteric vessels as in anterior superior mesenteric artery and superior mesenteric vein. Okay, the superior mesenteric vein is coming towards the neck, behind the neck of the pancreas. So it has to reach behind the neck of the pancreas to the superior mesenteric vein. Okay, so it comes in front, passes in front of the uncinate process, and then goes behind. So are you getting the course? it is present in front of one part of a pancreas. That is the unseen process. It is present in front. But when you see the relation of neck of the pancreas, it goes behind. So it goes like this, and then it goes behind, and then it goes behind. Okay, and posteriorly abdominal aorta. Okay. Another vessel is there, that is the superior mesenteric artery. The superior mesenteric artery is a direct branch of the abdominal aorta. Okay, the superior mesenteric artery, it it commences just below the celiac trunk. Okay, and it is a direct branch of the abdominal aorta. Okay, simple it is. So relations of the uncinate process is quite simple: anterior and posterior. There is nothing to the left or right, nothing like that. Okay, simple. Huh? Next is neck of the pancreas. See, in this diagram also you can see quite a bit of the posterior relations. Okay, so this is your uncinate process. ना uncinate process के in front में you can see the superior mesenteric vein. Superior mesenteric vein is going, and then it goes on the back of the neck of pancreas. You can see that, and here it is cut. This is the superior mesenteric artery which is cut here. Otherwise, you would have seen it is a continuous thing. It is a continuous thing, and on the posterior aspect, you can see a dark red thing, which is a abdominal aorta in the uncinate process. Okay. Anyway, understood. Then next is neck of the pancreas. So neck of the pancreas, what is the role of a neck? The neck connects the head to your body. Always the neck connects your head to your body, right? Connects head to the body. Okay, it connects head to the body. It's a small, it is a small, it is 2.5 centimeter. That is just an inch, 1 inch. Okay, it has two surfaces, the anterior surface and the posterior surface. The anterior surface and the posterior surface, and two borders, upper border and the lower border. Again, you have to understand the anatomy. That's why you should know the relation कि anteriorly क्या है, posteriorly क्या है, superiorly क्या है, inferiorly क्या है, आगे क्या है, पीछे क्या है, ऊपर क्या है और नीचे क्या है. Simple. Okay. Relations of the neck of the pancreas. Anteriorly, it has pylorus. So pylorus, everybody knows, pylorus is a gatekeeper. It is a gatekeeper of stomach. That is the end part of your stomach. Okay. So anteriorly, what is present? Pylorus. Okay. So that's why in the relation of stomach, you know that pancreas is always present in the stomach bed. This stomach bed is nothing but the posterior relations of stomach. Okay. So anteriorly, obviously, they are present in neck per pylorus. Are you getting me? Okay. Posteriorly, commencement of portal vein. Most important thing is here. Right? Posteriorly, that is behind the neck of the pancreas. Posteriorly is behind the neck of the pancreas. Behind the neck of the pancreas, you can see this, the superior mesenteric vein, and यहाँ से आने वाली splenic vein. Splenic vein and superior mesenteric vein both are uniting here, and they are forming a bigger vein, major vein. Vein is called as portal vein. So this is the most important thing you have to learn here. Okay, you can see that you can visualize the portal vein here, but no IVC. It also means that IVC is posterior to the portal vein also. Okay. Upper border, it is related to the obviously first part of the duodenum, and lower border, it is related to the root of transverse mesocolon. Your transverse mesocolon, the name transverse, it's somewhat misleading, okay? Because it is not exactly transverse. Transverse is like this, no? More sort of horizontal thing, transverse. But it is not transverse. It goes like this. It goes like this, or somewhat U shape. Okay, so it is not really transverse mesocolon, and that transverse colon is suspended like this U. It is suspended like this U with the help of transverse mesocolon. The root of the transverse mesocolon is related to the lower border. I hope you're getting me and I'm not going too fast. Okay, I'm trying to repeat each and everything again and again. Okay, okay. Body of the pancreas. Next is body of the pancreas. Elongated from neck to tail. It's a elongated part from neck से start होता है और tail तक जो जाता है, that is a body. It is present in front of the vertebral column and just below the transpyloric plane. Okay, it is present in front of the vertebral column. अभी तक हम लोगों ने हेड देखा था या फिर नेक देखा था, इसमें से कोई भी डायरेक्टली इन फ्रंट नहीं आ रहा था, लेकिन ये वाला जो पार्ट है, बॉडी वाला पार्ट, इट इज प्रेजेंट इन फ्रंट ऑफ द वर्टिकल कॉलम. ओके, एंड जस्ट बिलो द ट्रांसपाइलोरिक प्लेन. यू नो दोस प्लेन्स, देयर आर 4 मेजर लाइंस. द राइट मिड subclavicular, then right mid clavicular, then left mid clavicular, है ना? These are vertical planes and 2 horizontal planes are there. One is the transpyloric and another is the transtubercular, right? One of those lines are the transpyloric plane. It is a transverse line. It is a transverse line which passes through the pylorus. Simple. It is a transverse line which passes through the pylorus. Plane is a line. Okay, this line, अभी ये लाइन ऐसे 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 कैसे भी जा सकती थी ना, ऐसे ही क्यों गई? Because it is parallel to the transtubercular plane. Okay, transtubercular tubercle कहाँ पर होते हैं? इलियाक ट्यूबरकल्स. दोनों इलियाक ट्यूबर्स को जोड़ने वाली जो लाइन है उसको क्या बोलते हैं? ट्रांसट्यूबरकुलर. और उसको पैरेलल कौन होती है? ट्रांसपाइलोरिक. ओके, सो इट इज ट्रायंगुलर इन क्रॉस सेक्शन. इट हैज 3 borders: anterior, superior and inferior. So for learning point of view, I thought it might be a little helpful. Just my name. Okay, so it is triangular, है ना? So it is, can you see this? This is a triangular part. Okay, so your body of the pancreas is like this. It is triangular in cut section. अगर उसको कट करके देखेंगे तो the body वाला part is triangular. ठीक है, triangular बोलेंगे तो क्या आएगा? There will be 3 borders and 3 surfaces. Simple, है ना? 3 borders are, एक तो ये border है, एक ये border है और एक ये border. ठीक है, ऐसे क्यों? Because one border is anterior, which is present in the front. One is superior and obviously एक बच्ची कौन सी? inferior. Anterior, superior and inferior, 3 borders. और तीनों के बीच में जो surface होगा, तो anterior border and superior border के बीच में जो surface आएगा, it will present on the anterior aspect. You can see this and you can see this. That's why it is a anterior surface. One which you cannot see is a posterior surface, and one which is below, it is inferior surface. Simple. So that's why anterior, superior and inferior borders and anterior, posterior and inferior surfaces. See, can you see that? So there is a slight difference. Anterior superior border, yeah, and anterior posterior surface. Okay, 3 borders and 3 surfaces. And there is one process that is called as tuber omentale. It's called as tuber omentale. Tuber omentale is omental tuberosity. It is a slight process, slight elevation which is present in the body of the pancreas. It is present somewhat in the superior border. Okay. Again the relation, तो हमने के पार्ट कौन से देखे थे, एंटीरियर बॉर्डर, सुपीरियर बॉर्डर, इंफीरियर बॉर्डर, 3 बॉर्डर्स, एंटीरियर सरफेस, इंफीरियर सरफेस एंड पोस्टीरियर सरफेस. तो इनका और वो एक प्रोसेस का क्या रिलेशन होगा वो देखना है, सिंपल. सो एंटीरियर बॉर्डर अगेन इट इज रिलेटेड टू द रूट ऑफ ट्रांसवर्स मेसोकोलम. तो सपोज ये पार्ट यहाँ पर नेक है, सपोज को दिस इज नेक, तो नेक इज रिलेटेड एंटीरियरली किससे, रूट ऑफ ट्रांसवर्स मेसोकोलम. वही रूट ऑफ ट्रांसवर्स मेसोकोलम सामने की तरफ आ रहा है ना. सो इट इज कंटिन्यूअस एट द एंटीरियर बॉर्डर. देन द सुपीरियर बॉर्डर, सुपीरियर बॉर्डर में एक सबसे इंपॉर्टेंट चीज है, दैट इज सीलियाक आर्टरी या फिर सीलियाक ट्रंक. यू कैन कॉल इट एज अ सीलियाक ट्रंक. व्हाई इट इज कॉल्ड एज ट्रंक? बिकॉज इट इज अ लार्ज थिंग. Okay, it's a large artery, that's why it is called as celiac trunk. Then celiac trunk एक जगह पर है. Let's see the diagram. Yeah, see, can you see this part? This is a part, it's called as body. This is a body. Okay, okay, this is a body of the pancreas. In this body you can see there is one elevation. Can you see this? This elevation is nothing but your tuber omentale. This is tuber omentale. Okay. In bones, we used to study the tuberosity, the tibial tuberosity, very eminent, which is present on the front of your tibia. Likewise, there is a tuber omentale here. The tuber omentale, above the tuber omentale there is a celiac trunk. Can you see? यहाँ पर एक बड़ा वेसल है ना. This huge vessel is giving away celiac trunk. So celiac trunk has 3 branches. Is a trunk and it has 3 branches. Okay, 3 branches are hepatic artery, then splenic artery and left gastric artery. Okay, one to the right, that is hepatic artery, that is to the liver, that is hepatic artery. To the left, that is towards the spleen. You can see this snake like artery, that is the splenic artery. Okay, and towards the stomach, that is the left gastric artery. It's a part of celiac trunk. So tuber omentale is related to the, यहाँ पर क्या है, in the center celiac trunk या फिर celiac artery. To the right, hepatic artery. To the left, splenic artery. Simple. Then inferior border. Inferior border is related to the superior mesenteric vessels. Again, inferior border is related to the superior mesenteric vessels. See, this is the inferior border and it is related to the superior mesenteric vessels. Superior mesenteric vessels are nothing but, this is a superior mesenteric artery and this is a superior mesenteric vein. These 2 vessels are present on the inferior border of a body of pancreas. Okay, then anterior surface. Surface is related to the lesser sac and stomach. Again, है ना, याद है अभी हम लोगों ने नेक वाला पार्ट देखा था. नेक में क्या था, पाइलोरस था. नेक वाले पार्ट में क्या था, ये नेक वाले पार्ट में था पाइलोरस. तो उसके पहले वाले पार्ट में क्या आएगा, जो पाइलोरस के पहले वाला पार्ट होगा, दैट इज द बॉडी ऑफ द स्टमक, है ना, वो वाला पार्ट है. तो स्टमक ऑन द एंटीरियर सरफेस. पोस्टीरियर सरफेस, आयोटा. पोस्टीरियर में क्या है, ऑब्वियसली थोड़ी देर पहले मैंने बताया था कि एब्डोमिनल आयोटा ऑलवेज प्रेजेंट. एब्डोमिनल आयोटा एंड आईवीसी, तुम लोग को मैक्सिमम टाइम पर ये तुमको कहां पर दिखेगा, यू कैन सी इट ऑन द posterior aspect. Okay, then aorta, origin of superior mesenteric artery. Aorta and origin of superior mesenteric artery. Left kidney and left suprarenal gland. You must have understood we are shifting from the midclavicular plane towards the left side. So the relations are of left kidney and left suprarenal gland and the splenic vein. You know, in this diagram, there is no idea where the splenic vein is, because if you remove the pancreas, you can only then visualize the splenic vein. Okay, because it is exactly behind, so you cannot see it. Yeah? So that's why in posterior relation, okay, splenic vein is the one of the most important thing. Inferior surface is related to the duodenojejunal flexure, coils of jejunum and left flexure. See, the inferior surface, it is related to the duodenojejunal flexure. You can see the angle here. This angle is nothing but duodenum is ending and jejunum is commencing, and this flexure is called as duodenojejunal flexure. It is related to the inferior surface. Okay, at some coils of the small intestine. यहाँ पर अभी दिखाई नहीं है, यहाँ के coils ऐसे 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 करके जाते हैं. Okay, okay, understood relations of the body. Next, tail of the pancreas. It is a narrow extremity. It lies in the lienorenal ligament. In this, the line is nothing but related to the kidney. Okay, it's related to the kidney. Lies in the it lies to the spleen. Extremely sorry, it lies to the spleen and kidney. Spleen and kidney. Okay, lies in the lienorenal ligament. The ligament which, you know, attaches both spleen and kidney. तो स्प्लीन का जो लोअर विसरल सरफेस है वो, और लेफ्ट किडनी का अपर पार्ट, अपर पोल, ये दोनों एक साथ जुड़े हुए होते हैं विद द हेल्प ऑफ दिस लिनोरिनल लिगामेंट. तो वो लिनोरिनल लिगामेंट के यहाँ पर क्या आती है, टेल ऑफ द पैनक्रियास. इट इज मोबाइल, इज नॉट लाइक एकदम इतनी इतनी नहीं घूमती है, बट इट इज नॉट फिक्स्ड. इट इज द मोस्ट इम्पोर्टेंट. Contains large number of islet of Langerhans. Large number of islet of Langerhans. It is the जो उसका एक्चुअल एरिया है वो काफी छोटा है. The area is quite small and given the area, वहां पर जो densely populated होते हैं islets of Langerhans. Okay, see the tail of the pancreas. Okay, it is going here, you know. Then you can see the splenic artery, splenic vein ये पीछे से आ रही है. You can see that. So this is the splenic vein, this is the superior mesenteric artery. The superior mesenteric artery present है uncinate process के anterior में, but afterwards it goes behind the neck of the pancreas. यहाँ से आने वाली splenic vein, यहाँ से आने वाली superior mesenteric vein, both of them forming the majorly most important portal vein. See, this is a abdominal aorta, and this is a celiac trunk. You can see celiac trunk. It is giving away celiac artery, whatever. Okay, it यहाँ से जाने वाली, this is a hepatic artery. Then this is a splenic artery. Okay, these two are the major arteries. Okay, so you can understand. Simple. Okay, then इसको अगर सेक्शन लेकर देखेंगे हम लोग, ऐसे सी, दिस इज स्प्लीन है ना, दिस इज अ राइट साइड एंड दिस इज अ लेफ्ट साइड, दिस इज अ लेफ्ट साइड एंड दिस इज अ राइट साइड. You can see the liver and the relations of the organs. There is a cross section of duodenum, है ना. This major one is stomach. This is the anterior side ना. So liver, stomach, pancreas, then the mesenteric vessels, and extreme posterior में vessels कौन सी है, दोनों साथ साथ में चलती है. एक तो है abdominal aorta और दूसरी है IVC. Simple. Okay, these two things are kidneys. Okay, okay, I think you got it. See, this is from front. First part, second part, third part, everything is clear in this diagram. Very important diagram it is. Okay, and the one thing you cannot see is the posterior aspect. This is the thing. ओके, पोस्टीरियर एस्पेक्ट में ये सारी चीजें. सी, द स्प्लेनिक वेन is exactly behind the body of the pancreas. So that's why you cannot see in this diagram, you cannot see or you cannot locate the splenic vein at all, because at the commencement of the splenic vein, the tail of the pancreas is present. After that, it goes like this. So you can see that in this diagram. Okay, simple, understood? Okay, I guess you have. Next is the pancreatic duct system. There are two ducts. You can see there are two ducts in the pancreas. One is the main pancreatic duct and another is accessory. The accessory takes the pancreatic juice from the unseen process. यहाँ से आ जाती है और ये this is chief pancreatic duct which opens along with the common bile duct into the second part of the duodenum at the major duodenal papilla. If there is a major, there should be a minor. So this is a major duodenal papilla, it's a cap, and this is a minor duodenal capilla. Minor duodenal capilla में क्या enter करती है? Accessory pancreatic duct. Okay. So main pancreatic duct is Versum's duct and accessory pancreatic duct is Santorini's duct. Okay. And blood supply to the pancreas, obviously एक इतनी बड़ी आर्टरी है जो यहाँ से जा रही है, सो ऑब्वियसली कौन से सप्लाई करेगी, और यहाँ पर हम लोगों ने देखा था ऑलरेडी ये वाली है ना. तो मेन इज स्प्लेनिक आर्टरी, सुपीरियर पैंक्रियाटिकोड्यूडेनल आर्टरी एंड इंफीरियर पैंक्रियाटिकोड्यूडेनल आर्टरी. लेकिन स्प्लेनिक आर्टरी सबसे बड़ा सप्लाई है. एक्चुअली स्प्लेनिक आर्टरी तुम्हारे इज सीलियाक ट्रंक का सबसे लार्जेस्ट ब्रांच. Splenic artery is the largest branch of the celiac trunk. Okay, so it supplies major part of the pancreas. Okay, and along with that, superior pancreaticoduodenal artery and inferior pancreaticoduodenal artery. Okay, this superior pancreaticoduodenal artery is a branch of gastroduodenal artery, which is a branch of hepatic artery, and hepatic artery is a branch of celiac trunk again. Okay, and inferior pancreaticoduodenal artery, it is a branch of superior mesenteric artery, which is a branch of direct branch of abdominal aorta. Okay, simple. Okay, so splenic artery also, it supplies the major part. It has two major arteries. One is one supplies to the body, that is arteria pancreatica magna as in huge artery, arteria pancreatica magna, it is pancreatic artery सबसे बड़ी वाली, and chordae arteria pancreatic, okay, one which supplies to the tail. Then venous drainage, again the same name. Okay, that is a splenic vein, superior mesenteric vein and splenic portal vein and splenic vein. So one is splenic vein, obviously खास करके एंटायर कलेक्ट करती है. सुपीरियर मेसेंट्रिक वेन यहाँ से जाती है, पूरा कलेक्ट करती है, एंड दोनों जो फॉर्म करती है सुपीरियर मेसेंट्रिक वेन स्प्लेनिक वेन unites to form the portal vein. So these three, there are several small veins, like there are tributaries of superior mesenteric vein and tributaries of splenic vein here, which collects the drain. Splenic vein का सबसे बड़ा जो tributary है, that is the inferior mesenteric vein. All these veins, the gastroepiploic vein, then the anterior pancreaticoduodenal vein, posterior pancreaticoduodenal vein, all these veins ultimately drain into the either of superior mesenteric and splenic vein, and both of these unite to form the portal vein. Okay, what you have to understand the venous drainage, what is the importance of venous drainage here, that all major blood, major venous drainage goes to the portal system. Okay, that is most important. In the lymphatics, okay, pancreaticosplenic, celiac, superior mesenteric and pylori. Okay. Next is the nervous supply, sympathetic and parasympathetic. Sympathetic controls the vasomotor, and parasympathetic controls the pancreatic secretions. Okay, and next is the clinical anatomy. Clinical anatomy, it is the most important part, because you all are going to become a doctor and you should understand what is the need, what is the clinical anatomy, clinical correlation of a particular organ when you see a patient in your clinic. Okay, all this knowledge you have to apply here. This is a clinical anatomy. Okay, there are major two things which there are several other things, but major two things which can be seen. That is the first is carcinoma of head of the pancreas and acute pancreatitis. Okay, carcinoma of the head of the pancreas. See in this diagram I have tried to show यहाँ पर कैंसर डेवलप हो रहा है here exactly, एंड अगर कैंसर डेवलप होगा तो ये जो ऑल फ्लैश है एकदम सॉफ्ट वाला पार्ट इट विल बिकम हार्ड and it will exert the pressure on common bile duct and pancreatic juices. So entry of bile juice will be obstructed and the bile will not get out of the gallbladder and it will cause jaundice. That is obstructive jaundice. Okay. And next is acute pancreatitis. Wherever itis, that is inflammation. Okay. So acute pancreatitis, it is a severe pain. Patient comes with a severe pain. Okay, in the case of acute pancreatitis. Understood? It is extremely important topic. The pancreas, extremely important topic for your exam or your clinic. In the knowledge to become a good doctor. Then for your second year, third year, fourth year, anywhere the knowledge of pancreas is essential. And that's why everybody always tries to study liver and stomach for your final exam. But I have seen students trying to ratify these two topics always for their exam. But I think pancreas have been asked more times than any of these. And the answer is quite small compared to the stomach and liver. So it is beneficial as well. It is very well to remember and you can write in say 20-25 minutes. So आपका पेपर छूटने का भी चांस नहीं. बहुत सारे लोग कंप्लेन करते हैं कि सर टाइम कम पड़ता है. तो again it is very important in that aspect also. So try and learn pancreas. I hope तुम लोग को समझ में आ गया होगा. This is a very short while in which I have tried to make you understand. Actually, I take 2 to 3 lectures at least for this particular topic. Anyway, thank you very much. If you have any queries, any questions, you can raise your hands. Okay. If you have any questions later on, I have given my contact number. If you want to clarify anything, you can ask me.